New COVID booster shots are expected to be made available this week. CVS stores, most clinics and pharmacies should have their supplies within days, and many Southern California pharmacies are already taking appointments. The new shot targets new variants that are circulating, and we have a lot to talk about on the COVID front this week. And to break it down, we are joined by our resident medical expert, board-certified ER Dr. Michael Daignault. Thank you so much.
Good evening.
So these new COVID symptoms that are presenting themselves, the common thread is a sore throat, right?
Yeah, it's very interesting. We're seeing a change in how patients are presenting or at the ER and or at home. The first symptom that they seem to be experiencing is very severe sore throat. And what happens is the virus gets into the back of the throat, travels up to the posterior part of the nose, and then you have a heavy runny nose, which is your body's just trying to get rid of the virus. So it's definitely a different presentation. So you have the sore throat, the headache, the fatigue, and maybe not the fever and maybe not the cough this time around.
Interesting. Okay, so really presenting more like the flu. So I know somebody personally who had that all of those symptoms, tested at home twice, back to back, negative, went to the doctor, took the PCR, positive. So is this going to change how we swab ourselves at home?
So it's really interesting. Again, your story is like many other anecdotes that we're hearing, that people are doing the rapid test at home and turning up negative and then doing a PCR and finding out that it's positive. And so we really don't have any new guidance on whether the variants are able to escape the rapid test we have. But what I suggest for people is when you're worried you have COVID and that sore throat starts, you want to take that swab and gently swab the back of your throat, especially at the beginning of symptoms. And then do it again 2 days later when it becomes a heavy runny nose. Then you swab the nose, because that's where the majority of the virus is. And so what that will do is it'll increase the yield of the test's ability to detect COVID.
Okay.
And your other option is to go get a PCR test. And this is important to find out if you test positive now, because like you mentioned at the outset, the new vaccine is available. So if you test positive, then you can wait 4 to 6 months before you get the new vaccine.
Now I want to get your thoughts on something that the CDC said recently, and that is essentially that the N95 masks, which is what healthcare workers most often wear, right?
Yep.
Equivalent to those are just the regular surgical masks. What do you make of that? What's your reaction?
So it's just like adding more confusion to the debate on masks. I mean, it goes contrary to a 2022 study from the CDC, which showed that the N95 masks are twice as protective as a surgical mask. And we have a UK study, which is even more extensive and broader based, which shows that N95s are stronger. And so even before COVID, we knew when to use the N95. Somebody suspected of meningitis, tuberculosis, and now when we're doing a procedure on somebody suspected of COVID, we go with the N95. And so there's been a lot of pushback from doctors against the CDC because of this, and they said that they're open to feedback, and I hope we take a broader look at this. But in the end, I mean, we know enough. It's just like when we had that LA County mandate to tell doctors and nurses to wear masks. I mean, we know enough as professionals what grade mask to use and when, and we've been doing that for a long time. So just let us do our thing.
Okay, yeah, exactly. We have about a minute left. So from COVID to RSV, the vaccine is recommended for people 60 and older, and some folks are having a hard time getting that paid for. They're having to pay out of pocket, especially if you're on Medicare. What do you suggest? Yeah,
hundreds of dollars in some cases. Is deferring back to the private insurance. So 2 suggestions I have for people. 1, check if you have Medicare Part D. Because if you have Medicare Part D, that should cover the vaccine. If you go to the pharmacy and they're still refusing to give you the vaccine because you don't have Medicare Part D and you have private insurance, ask your primary care doctor to write it as a prescription for you. Call the pharmacy, call in the vaccine for you, because then the private insurance will cover it.
Okay. Otherwise, you could be paying $300 for a vaccine.
That's recommended.
Okay.
Right.
All right. Dr. Michael Daignault, thank you for enlightening us on this Monday.
My pleasure.